Imagine not having access to resources that can impact your health. Sadly, for some people in the United States, that is a reality for them, in part because there are so many external factors that can impact your overall health and wellness. These factors are theorized to be the social determinants of health. These are listed as education, socioeconomic status, the neighborhood and built environment, your social and community connectivity, but also healthcare access and quality. This study focused on healthcare access and quality as a determinant of health. Specifically, I investigated the state of Florida and the primary care provider rates among the different counties. My research was inspired by a physician named Dr. Basu. He conducted an analysis on different counties. He wanted to see how many primary care providers there were and the life expectancy. The results of that study can be seen on this line graph, where the primary care physicians per 100,000 persons in that specific county is compared on the y-axis to the age-adjusted life expectancy. These findings are showing that as the amount of primary care physicians in an area is increasing, so is the life expectancy. And this is significant because it's telling us that through adding in more primary care providers to an area, we can help these health outcomes, something such as important as like how long you're able to live. The main findings of this study was this golden ratio to your right. It is one primary care provider per 1,500 people in a county. This means a county of 3,000 people would need 2 primary care providers to be considered adequate. They calculated this by looking at counties that had less than this ratio, and they wanted to make an estimate on how the life expectancy would change if they added in more primary care providers. They found an increase of almost 56 days. So I wanted to see, how does Florida shape up with this? Which counties are at that 1 to 1,500 ratio? And spoiler alert, that's exactly what I did. The first thing I did was I collected the primary care provider numbers using county health rankings. This is a source through the University of Wisconsin. I extracted the data from 2020 because I wanted to make it match with the county census population data, my step 2. I took those 2 sources of data and I put them together to calculate the 1 to 1,500 ratio per each county, and then I put it on a pretty map for all of us to look at together. This is the epitome of my research, the most significant findings. It is the primary care provider per 1,500 persons broken down by counties for our state of Florida. The darker blues show less adequate health accessibility specific to primary care, and then the lighter colors show more health accessibility. This is significant because we can see that there are clear geographic disparities, and going back to our previous research, we know that these can impact the longevity of your life. So through critically examining our state with that research evidence-based lens and looking at our workforce infrastructure, we can better cultivate programs and policies that can address the health accessibility needs. Thank you.